My name is Bingming Qi. I'm the associate professor at M. Louis Fitzpatrick College of Nursing, Villanova University. My topic for this poster presentation is the moral distress mitigation program in undergraduate nursing practicum, development and evaluation. First, I'd like to acknowledge my co-investigators and my co-authors, Professor Jackie Parkinson and two BSN Express students, Eugene Park and Nicholas Schlegel, for their contributions to the study. This topic was supported by the University Vital Mini Grant and the FCN BSN Express Research Match Program. Moral distress has a direct relationship with concern about work competency, burnout, job dissatisfaction, and decreased quality of patient care as evidenced by increased medication errors. Studies have shown that curricular interventions aimed at improving resilience and increasing ethical confidence and moral competence are more effective in reducing moral distress among new nurses than among those who have worked for 10 or more years. However, literature review indicate a gap between the academic preparation of students' nurses and the practical challenges faced by professional nursing. Few studies have addressed strategies for dealing with moral distress in nursing curriculum. To address these discrepancies, a moral distress mitigation learning program for pre-licensure nursing students was developed to enhance participants' ability to understand, recognize, and confidently manage ethical situations while fostering resilience and reducing moral distress. The purpose of the study was to evaluate the effectiveness of one semester-long moral distress mitigation intervention in achieving statistically significant improvement in the following areas. 1. Decreased level of moral distress. 2. Increased perceived ethical confidence in recognizing, understanding, and managing challenging situations. 3. Enhanced moral competence related to reasoning and judgment. 4. Increased resilience by the end of the 14 weeks clinical practicum compared to pre-intervention. This study employed a one-group pre-test post-test design. The moral distress mitigation intervention was implemented in the junior or senior medical surgical level clinical practicum course. Pre-intervention data were collected from students who consented prior to the first day of clinical, and post-intervention data were collected immediately after the final day of clinical. The intervention included a 1-hour workshop on moral distress based on AACN's 4A's model and Bandura's self-efficacy theory, plus biweekly reflective journaling on moral distress experiences with faculty written feedback. Results: 83 traditional and second-degree students consented to participate in the evaluation of the curriculum, with 48 completing both pre- and post-intervention surveys. Among them, 86.9% were female, 60.7% were white, 15.5% were Asian Pacific Islander, 10.7% were Black, and 4.8% were Hispanic. The mean age was 25 plus minus 6 years. The results of the paired sample t-test showed a significant post-intervention increase in students' moral competence in general and specifically when facing difficult situations and cooperating with relevant people, both p less than 0.001. Additionally, students' perceived ethical confidence showed statistical improvement at the end of the semester, p less than 0.001. However, students' resilience remained unchanged. There was a decrease in moral distress from a mean of 61.77 to 48.94, though this reduction was not statistically significant. Conclusions to practice. This semester-long moral distress mitigation curriculum successfully enhanced the students' moral competence and perceived ethical confidence, particularly in facing morally challenging situations and cooperating with relevant professionals and/or organizations. These results demonstrate its value in preparing nursing students for ethical challenges. However, the lack of control group limits the generalizability of the study. More targeted interventions, such as simulation experiences or other rigorous approaches, may be necessary to significantly decrease moral distress and improve resilience. These findings highlight the need for ongoing development of evidence-based training to better support nursing students' professional growth and ethical readiness. Thank you very much for your attention to this presentation. Please feel free to reach out if you have any questions. Thank you.